stroke doesn't always begin with a collapsed body. It can start with a single strange chill under your arm or one word you suddenly can't say. In the next few minutes, you'll discover the hidden signs most people miss and why waiting even 1 minute could cost a lifetime. Welcome to Wellness Unfolds, where we uncover the silent whispers of your body that could save your life from a stroke. Time is the most critical factor when dealing with a stroke, as every single passing second destroys millions of brain cells. Statistics show that 80% of strokes are preventable, yet millions suffer because they miss the subtle warnings until it is too late. Today, we will explore 9 critical signs, ranging from the most common symptoms to the incredibly subtle ones you might ignore. Some signs are obvious and terrifying, while others disguise themselves as minor inconveniences that we often brush off without a thought. We will pay special attention to a bizarre temperature sign in the underarm area that almost everyone overlooks during a crisis. Understanding the biology behind these signals empowers you to act fast, potentially saving a loved one or even your own life. Let us begin our journey through the body to identify these red flags, starting with a pain you must never ignore. The first sign is often described by survivors as the worst headache of their entire life, striking out of nowhere instantly. Unlike a normal migraine that builds up slowly, this thunderclap headache hits maximum intensity within seconds, signaling a serious vascular event. This pain often indicates a narrowing of the carotid artery or a sudden hemorrhage that increases pressure within the skull rapidly. When blood leaks or vessels swell, the brain has no room to expand, causing this specific and terrifying type of agony. Do not mistake this for stress or dehydration. If the pain is localized to one side and severe, call emergency services. This blockage prevents oxygen from reaching critical brain tissue, and pain is the brain's immediate and urgent cry for help. If you or someone else experiences this sudden explosion of pain, do not wait for it to pass. Act immediately. The second sign involves your eyes, often manifesting as a sudden loss of vision in one eye or strange double vision. Victims often describe a sensation like a dark curtain being pulled down over one eye, blocking their view of the world. This happens because the stroke affects the occipital lobe, the part of your brain responsible for processing all visual information. Double vision can also occur if the brain stem is affected, disrupting the coordination between your two eyes and their movement. It is not an eye problem, but a brain problem. The eyes see clearly, but the brain cannot process the signal. Sometimes, a small clot can travel specifically to the retinal artery, causing temporary blindness that serves as a major warning sign. Many people ignore this, thinking it is just fatigue or dust, but sudden vision loss is a medical emergency requiring attention. The third sign is a terrifying inability to speak clearly, find the right words, or understand what others are saying to you. This condition is known as aphasia, and it strikes when the stroke impacts the language centers in the brain's left hemisphere. Broca's area controls speech production. When it is deprived of oxygen, you physically cannot form the words you want to say. Alternatively, Wernicke's area affects comprehension. You might speak fluently, but your sentences will be a jumbled salad of meaningless words. Slurred speech, or dysarthria, happens when the muscles used for speech become weak or paralyzed due to the lack of brain control. If a conversation suddenly becomes impossible or confused, it is a hallmark sign that a stroke is occurring right now. The fourth sign is sudden weakness or numbness that typically affects only one side of the body, such as the arm or leg. You might feel like your arm has fallen asleep, but unlike a sleeping limb, the sensation does not return with movement. The brain's right side controls the body's left side and vice versa. A stroke in one hemisphere paralyzes the opposite limbs. A simple test is to try raising both arms. If one drifts downward or cannot be lifted, the brain connection is broken. This heaviness can also affect the leg, making walking impossible or causing the person to drag one foot while trying to move. Do not assume you just slept in a bad position. Sudden, unexplained numbness on one side is a red flag for stroke. The fifth sign involves a sudden loss of balance, coordination, or a sensation that the room is spinning violently around you. This is not simple clumsiness. It feels like the floor is tilting or moving, similar to the feeling of being extremely intoxicated. This points to issues in the cerebellum or brainstem, the areas responsible for maintaining your equilibrium and fine motor control. When these areas are starved of blood, your body loses its ability to orient itself in space, leading to dangerous falls. You might also experience ataxia, which is the loss of control over body movements, making simple tasks like grabbing objects difficult. Vertigo associated with stroke is often accompanied by nausea and vomiting, distinguishing it from general dizziness caused by standing up too fast. The sixth sign is perhaps the most recognizable visual cue of a stroke, the sudden drooping or numbness of the face. When asked to smile, the face will appear uneven. One side of the mouth will stay down, creating a grimacing expression. This happens because the facial muscles lose their tone instantly when the brain stops sending signals to hold them in place. It can also affect the eye on the same side, causing the eyelid to droop, making the face look sad or melted. This sign is critical because it is visible to others immediately. It is the F in the FAST acronym for stroke detection. Now we reach the seventh sign, the most overlooked indicator, a bizarre difference in temperature or smell in the armpit area. This is not about fever. It is a specific asymmetry where one armpit feels significantly cooler than the other by 2 degrees. Deep within the brain, the hypothalamus regulates temperature, but a lack of blood flow can disrupt this delicate thermal balance significantly. A stroke can damage the autonomic nervous system pathways that travel from the brain down to the skin and sweat glands. This disruption leads to anhidrosis, or lack of sweating, on the affected side, causing that specific area to feel cooler and dry. Conversely, the healthy side might overcompensate by sweating more, creating a noticeable difference in moisture and temperature between the two sides. This change in sweating patterns can also alter body odor suddenly, creating a smell that is different from your usual scent. This sign is extremely subtle. Most people do not check their armpits during a medical emergency, which is why it is missed. The interruption occurs in the descending sympathetic tract. When this pathway is cut, the body loses its ability to regulate local temperature. This phenomenon is often linked to Horner's syndrome, a condition that combines this temperature change with a drooping eyelid and constricted pupil. You might observe this dryness extending up to the face. One side of the forehead might be sweaty, the other bone dry. If you notice this strange mismatch in temperature or sweating along with other symptoms, it confirms the brain's control center is failing. The hypothalamus is struggling to maintain homeostasis. This struggle manifests physically on your skin, serving as a silent but urgent alarm. For caregivers, simply touching the skin on both sides of the body can reveal this vital clue that machines might miss. Remember, a difference of more than 2 degrees Fahrenheit is clinically significant and points directly to a disruption in the autonomic system. Temperature asymmetry, changes in sweat patterns, and altered body odor are the trifecta of this hidden sign that you now know. While the armpit sign is rare, our next sign appears in the stomach, confusing many into thinking they just have food poisoning. The eighth sign is sudden, unexplained abdominal pain, a symptom that seems unrelated to the brain but is actually deeply connected. This is not a stomachache from bad food. It is a sharp disruption caused by the brain failing to communicate correctly. The vagus nerve connects your brain directly to your gut. A stroke can scramble the signals sent along this superhighway of nerves. When the brainstem is ischemic, it sends chaotic signals to the abdomen, causing cramping, nausea, and sudden vomiting without warning. Nausea, combined with dizziness, is a classic presentation of a stroke in the cerebellum or brainstem, often misdiagnosed as a virus. If abdominal pain strikes simultaneously with other symptoms like headache or dizziness, do not treat it with antacids. Call for help. The final sign is sudden confusion or a rapid decline in cognitive ability, where the person seems lost in a familiar world. They might forget where they are, miss an appointment they just made, or be unable to perform a simple routine task. This indicates that the stroke is affecting the frontal lobe, the area responsible for executive function, memory, and processing complex information. Processing speed slows down dramatically. Questions that should be easy to answer take a long time or receive nonsensical responses. This sudden change in personality or mental sharpness is often dismissed as tiredness or aging, but it is actually an acute emergency. We have covered 9 distinct signs. Some are physical, like a drooping face, while others are hidden, like temperature changes or confusion. To remember the most common symptoms, medical professionals use the acronym FAST. It is a simple tool that saves countless lives daily. F stands for face. Ask the person to smile. Does one side of the face droop? This is the first check. A stands for arms. Ask them to raise both arms. Does one arm drift downward? Weakness is a major warning sign. S stands for speech. Ask them to repeat a simple phrase. Is their speech slurred or strange? Can they understand you? T stands for time. If you see any of these signs, even if they go away, call emergency services immediately. Do not wait. There is a clot-busting drug called TPA that can reverse stroke damage, but it must be given within a few hours. Every minute you wait reduces the chance of recovery. Acting fast preserves brain function and quality of life for the survivor. Sometimes symptoms disappear quickly. This is a transient ischemic attack, or mini-stroke. It is a major warning of a big stroke coming. Never ignore a mini-stroke. It is your body giving you a second chance to get medical help before the real catastrophe strikes. Now that you know the signs, let us talk about prevention. Remember, 80% of strokes can be prevented with lifestyle changes. High blood pressure is the single biggest risk factor. Managing it is the most effective way to protect your brain's health. Reduce your salt intake. Excess sodium raises blood pressure, putting immense strain on your delicate cerebral blood vessels over time. Exercise regularly. Just 30 minutes of moderate activity a day keeps your blood vessels flexible and reduces the risk of clots. Stop smoking immediately. Smoking thickens your blood and increases plaque buildup in arteries, making a blockage much more likely to occur. Manage diabetes carefully. High blood sugar damages blood vessels over time, making them more prone to clots and rupture. Check for atrial fibrillation. This irregular heartbeat allows blood to pool and clot in the heart, which then travels to the brain. Treat sleep apnea. The oxygen deprivation during sleep raises blood pressure and stress on the brain, increasing stroke risk significantly. Limit alcohol consumption. Excessive drinking raises blood pressure and can trigger irregular heartbeats that lead to stroke events. Adopt a diet rich in fruits, vegetables, and omega-3 fatty acids. These foods protect your arteries and lower bad cholesterol levels. Manage stress. Chronic stress keeps your blood pressure high and your body in a state of inflammation, damaging your vascular system. Maintain a healthy weight. Obesity increases the strain on your heart and is linked to diabetes and high blood pressure. Regular checkups are vital. Knowing your numbers for blood pressure and cholesterol allows you to correct issues before they become strokes. Your health affects everyone who loves you. Taking care of your body is a gift to yourself and your family. Knowledge is power. By understanding these 9 signs, especially the subtle ones, you become a guardian for yourself and others. Do not forget the armpit sign. It is a rare piece of knowledge that could be the key to early detection. Share this information. Most people know the facial droop, but few know about the vision loss or temperature changes. Never try to diagnose yourself or drive yourself to the hospital. Call an ambulance so treatment can start on the way. Paramedics can alert the hospital, ensuring a stroke team is waiting for you at the door, saving precious minutes. Your brain is resilient, but it is also fragile. Treat it with care, feed it well, and listen when it speaks. Take a moment to memorize these signs. Write them down. Keep them in your phone. Be ready to act if needed. Recovery is possible, but prevention and early detection are always better. You have the power to change the outcome today. Countless stories exist of people who noticed a slight slur or a vision blur and acted fast, saving a life completely. Conversely, waiting to see if the symptoms pass can lead to permanent disability or death. The risk is never worth taking. Strokes are not just for the elderly. Lifestyle choices and stress are causing strokes in younger people more than ever before. Stay hydrated. Thick, dehydrated blood is harder to pump and more likely to clot. Drink water throughout your day. Prioritize sleep. During deep sleep, your brain cleanses out toxins and repairs vessels. Depriving yourself of sleep invites danger. For women, be aware that certain hormonal medications can slightly increase risk. Discuss your personal risk factors with your doctor. Know your family history. If your parents or siblings had strokes, your risk is higher, and you must be extra vigilant. Vaping is not a safe alternative. Nicotine in any form constricts blood vessels and raises blood pressure, inviting stroke risk. Cholesterol is a silent killer. It builds up slowly over years, narrowing your arteries until a clot gets stuck instantly. A simple blood test once a year can reveal your cholesterol profile. It is a small prick for a huge protection. Yoga and stretching improve circulation and reduce arterial stiffness. Keeping your body flexible helps keep your blood vessels flexible too. Cut down on refined sugar. It causes inflammation in the blood vessel walls, creating rough spots where plaques can easily form. Eat more potassium-rich foods like bananas and avocados. Potassium helps relax blood vessel walls and counteract the effects of sodium. Dark chocolate in moderation contains flavonoids that improve blood flow. A small treat can actually be good for your brain. Laughter is medicine. It relaxes your blood vessels and improves blood flow for up to 45 minutes after a good laugh. Owning a pet can lower your blood pressure. The simple act of petting an animal reduces stress and protects your heart. Spend time in nature. Fresh air and green surroundings lower cortisol levels and improve your overall cardiovascular health naturally. Stay socially connected. Loneliness is a risk factor for stroke. Engaging with friends keeps your brain active and your stress low. Learn something new. Building new neural pathways creates a cognitive reserve that can help your brain withstand damage better. Listen to soothing music. It has a direct effect on your parasympathetic nervous system, calming your heart and opening blood vessels. A warm bath can improve circulation. Just ensure the water is not too hot, as extreme heat can stress the heart. If you work at a desk, stand up every hour. Prolonged sitting slows blood flow significantly and increases clot risk. Monitor your resting heart rate. If it is consistently high, consult your doctor as your heart is working too hard. Watch your caffeine intake. While a little is fine, too much can spike blood pressure and trigger palpitations in sensitive individuals. Flavor your food with herbs and spices like turmeric and garlic instead of salt. They have anti-inflammatory properties that help you. Control your anger. Outbursts of rage can trigger a stroke by causing a massive spike in blood pressure and adrenaline. Take care of your teeth. Gum disease causes inflammation that can spread to your blood vessels and increase stroke risk. Get your flu shot. The inflammation caused by a severe flu infection can actually trigger a stroke in vulnerable people. Listen to your body. It whispers before it screams. Paying attention to small changes is the key to long-term survival. Wellness is a journey, not a destination. Every healthy choice you make today builds a stronger barrier against stroke tomorrow. Let us recap one last time. Headache, vision, speech, weakness, dizziness, face, armpit temperature, stomach pain, and confusion. Remember them. It is better to call the hospital and be wrong than to stay home and be right about a stroke. You are not alone. There is a vast community of survivors and doctors working tirelessly to defeat this silent killer. Thank you for investing your time in this video. You have armed yourself with knowledge that is truly life-saving. If you found this helpful, please subscribe to Wellness Unfolds. We are dedicated to bringing you vital health insights weekly. Share this video with at least one person you love. You might just be the reason they survive a stroke. Comment below if you or a loved one has experienced any of these signs. Your story could help someone else. Life is beautiful and precious. Let us protect it with vigilance, knowledge, and proactive care for our amazing bodies. Please remember this video is for educational purposes only. Always consult with your healthcare provider for professional medical advice and diagnosis. This has been Wellness Unfolds, unfolding the secrets of health, one video at a time. Stay healthy and stay safe. Thank you for watching. We will see you in the next video with more life-changing information. Goodbye for now.